A very warm welcome to everyone, and thank you for joining us across the world today for the second webinar hosted by the International Early Intervention and Prevention in Mental Health Association. My name is Maria Mikhail, and I am the IEPA Vice President for Europe. Today, we focus on a topic that continues to generate global concern and debate: the role of social media in young people's experiences of self-harm and suicide. And while much public attention centers on risk and exposure to harmful content, young people also tell us that social media can be a vital space for connection, support, and help seeking when other forms of support are not available. I am delighted to introduce Professor Jo Robinson today. Jo is the head of the Suicide Prevention Unit at Origin. She's the scientific director of the Origin Policy Center and the president of the International Association for Suicide Prevention. Today, Jo will share findings from an extensive program of work examining how social media can be harnessed for suicide prevention. The talk will take approximately 40 to 45 minutes, and then we'll have a Q&A session. So please do share your questions using the Q&A function. We are delighted to have with us Jo today and very grateful for the expertise she brings to this global conversation.
Thank you so much. Thanks for that kind introduction, Maria, and thanks for joining everybody. It's a real pleasure to be here. IEPA is an organisation that's very close to my heart and very close to the hearts of all of us at Origin. I would like to begin, first of all, by just acknowledging the traditional owners of the lands that I'm talking to you all from here this evening in Melbourne. So I'm on the lands of the Boomerang people, and I would like to pay my respects to their elders past, present, and emerging, and acknowledge that sovereignty of these lands was never ceded. So I am here to talk about a hot topic this evening, the role of social media in youth suicide prevention. So as probably most people here know, suicide is the leading cause of death in young people, including in many parts of the world and including here in Australia. And you can see here from the graph that rates are higher. And I deliberately want to show this graph actually, because you can see here that rates are higher in young men, boys and young men. But actually what's happening here in young girls, young women and girls, is rates are going up. And they're going up actually quite dramatically. In contrast, they seem to be coming down a little bit here. And I always like to draw attention to this because what I think this might be telling us is that we've put a lot of investment into suicide prevention in young men, or in men generally, actually, here in Australia. And this makes me wonder if actually all of that investment is starting to pay some dividends. Whereas unfortunately, the same sort of attention and investment hasn't gone into suicide prevention in young girls or women. And what we're seeing here are these rates going up. But as, again, most of you will know, suicide is a complex problem. Now, we're here to talk about the relationship between suicide and social media. But it's very rare that one cause or one factor alone contributes to suicide. We've just done a significant piece of work, a significant sort of national survey, population-based survey, where we have been looking at the prevalence of suicide, suicidal ideation, self-harm, and depression and anxiety in young people across Australia. And in doing that, we also asked them what it was that they were concerned about. And I know this is a bit of a messy graph, but I wanted to show it because I wanted to point out that, there are some really broad factors here that are impacting young people's mental health and suicide risk, including things like cost of living, housing affordability, climate change, racism and discrimination, all sorts of things like that. And actually, the content that they're exposed to on social media is fairly high up the scale. So, when I say high up the scale, low down the scale. These are the things that are having the biggest impact, or young people say are having the biggest impact on their mental health. But social media, although in the same survey, 90% of young people told us they use social media quite significantly, only around 25% said it was having a negative impact on their mental health. Now, that's all up for debate. And we can talk more about that as we go on this evening. But I wanted to show this because I wanted to just really show the complexity of the factors that young people tell us are contributing to their poor mental health and suicide risk. In response to all of these sorts of factors, we've started to think about what would a public health approach to suicide prevention look like here in Australia. And again, probably this is familiar to many people, but what we've done here is map out things like the broad social or structural determinants. Sometimes when I'm feeling a bit mischievous, I call them political determinants, because political decisions and policies actually impact these sorts of determinants here. So things like economic policies, public policies around things like consumption of alcohol, housing policies, and all of those sorts of things. And we've been starting to think about, well, what are the impacts of these sorts of policy decisions on these individual risk factors that then impact mental ill health and suicide and self-harm. And I guess one of the other things to draw people's attention to on this slide is in here, which is this piece around legislative or regulatory frameworks. So again, we're used to thinking, when we're thinking about suicide prevention, we're used to thinking about things like firearm ownership and what impact regulatory frameworks around legislation around firearm ownership might have on suicides in particular countries. We're less used to thinking about online regulatory frameworks and the impact that could have on suicide. But when we start to think about the relationship or the potential relationship between social media and suicide prevention, this piece in here starts to become a bit more important. And we summarized all of this, as you can see here, in an editorial a little while ago that was led by my colleague, Jane Perkis. So what is it that we worry about, or why do we worry about the relationship between social media and suicide? What is it that we think is harmful? So you can see here that social media content could be unsafe or distressing if it depicts or describes specific methods of harm, is graphic or detailed in those depictions, whether that's kind of in terms of the language used or in terms of the images portrayed, is instructional, so encourages or gives instructions for self-harm or suicide, and shows the outcome of self-harm or suicide. And most of this evidence, certainly when we began this piece of work, which was around, or this body of work, which was around 10 years ago, social media was probably, or the way it was being used and the concerns around it was probably relatively new. We were certainly at a bit of a pivotal point there where a lot of the evidence generated at that time had really come from mainstream media. So we knew from the evidence around mainstream media reporting that these sorts of things were potentially harmful. They were distressing, but they were also potentially harmful. They might lead to imitative type behavior. So the dominant narrative at that time was really that young people shouldn't be talking about suicide on social media, that it was harmful, and we really wanted to discourage young people from doing that because of that potential for harm. But there were clearly some fundamental differences, I guess, between traditional and social media. And young people have quite a unique relationship with the online world. So as we do at Origin, we talk to young people and we listen to what they had to say. And they really told us probably something that won't come as a big surprise to people, which is simply by telling them not to use social media, which is what we were thinking at the time, wasn't really going to work. Young people have a knack of getting around doing things that adults perhaps say that they shouldn't do. But they also told us that they use social media for a particular set of purposes, which we'll get to, but that might have a preventative focus in terms of, as Maria said in the introduction, things like building community or reaching out and seeking help. But I would argue that we're probably at another pivotal point right now when it comes to how we're thinking about the online world and social media and its relationship to young people's well-being, which led us in Australia to take a particular regulatory approach, which was restricting social media access to young people under the age of 16. Now, probably many of you will know about this legislation. I think it's kind of caught the attention of most countries around the world. And as I say, in December last year, after a very short period of kind of lead-in period and no real evidence to support it, the Australian government decided that enough was enough. And what we were going to do was introduce some minimum age legislation where young people under the age of 16 were going to be restricted from accessing social media platforms. And I'm sure people will have questions about that, and I'm more than happy to discuss it and take any questions on it. What I will say, actually, before I do move on, is that that particular piece of legislation is being evaluated. So I know that lots of countries around the world are kind of poised to follow suit. And in fact, Indonesia already has followed suit. We are doing a fairly robust, or the Office of the Safety Commissioner is doing a fairly robust evaluation of that particular piece of legislation, supported by the Social Media Lab at Stanford University. And so over time, what we will have is some reasonably good evidence around the impacts of this legislation, including any potential unintended harmful consequences. And I think that really speaks to the fact that the policy debate that we've had, and in fact, most of the debate that we've had, has centered around the harms of social media. But our work has really also focused on how social media could be used at scale for preventative purposes. And the evidence for that has grown substantially over the last decade or so. So again, I think back 10 years to when we really began this body of work, we did kind of a seminal systematic review, if you like, that looked at the ways in which social media was being used for the purpose of suicide prevention. And a PhD student of mine, Charlie Cooper, has just updated that systematic review, synthesizing the most recent 11 years worth of evidence on how social media is now being used for the purpose of suicide prevention. What you can see clearly from the slide is there was a substantial increase in the amount of work or studies that have been going on in the last 11 years. There were 27 intervention studies that he identified. There were none in our original review. There were lots of descriptive studies, people thinking about how social media could be used for preventative purposes, but nobody was really testing any interventions. Whereas now there were, as you can see, there were 27 of those in the current review. And you can see also that social media is now being used across the prevention continuum. So it's being used in that very universal kind of population-based way, from education and awareness campaigns to kind of more selective and indicated, if you like, or targeted interventions designed to identify or treat or support people who are expressing risk online. So for crisis detection purposes, or even to deliver brief in-platform single session interventions, those sorts of things. It's also being used for suicide postvention, so to deliver support to people who have been bereaved or exposed to suicide in somebody that they love or care for. You can also see that for many young people in that we identified through the review, social media was in fact the only place that they felt safe or able to disclose suicidal distress, particularly those facing barriers to offline care. So there was a real piece in here around young people accessing social media for this purpose because it gave them a sense of belonging and a sense of connection, and also because they could seek help without feeling like a burden to others. And for those of you that are familiar with suicide prevention theories, you'll know that those pieces, or those kind of those factors like burdensomeness or perceived burdensomeness and lack of belonging are actually risk factors for suicide. So actually social media could have the potential, if used in the right way, to mitigate some risks, not just to cause harm, but actually to mitigate some risks. So actually to have these preventative purpose. Most of the suicide prevention activities that came up in this review were in fact user-led, so peer support, crisis disclosure, and sharing stories of hope and recovery, most often on mainstream platforms, so your Facebooks and your Instagrams, that were really never designed for this kind of purpose. And the other thing that we found, which has echoed other bits of research that we've done over the last 10 years, the benefits really coexist alongside the harms. So young people actually have to work fairly hard to keep themselves safe in these environments, even when they're using them for good, so to seek help or to foster connection. So there's this piece around exposure can provide emotional relief for some, but it can also increase urges or imitative behavior in others. And the harms appear to be concentrated in those less moderated and more mainstream platforms, as opposed to social networking environments that might have been developed by clinicians or researchers. Another piece of work that one of my colleagues led here was from a different national survey of school-aged young people across Australia. And here what they found was that moderation is really key. So people that were using social media in a moderate way, so for 1 to 3 hours a day, fared as well as, sometimes better than, those that weren't using it very much at all. Those that used it for more than 3 hours a day, and we know that many young people do, that was associated with elevated psychological distress and feelings of loneliness. And again, probably the important thing to point out here is that's an association. There's very little, if any, causal research out there. So there's a lot of associations, there's a lot of correlational research, but not much causational research. So we desperately need longitudinal studies that can look at causal relationships here. And you can see again from the slide that female, gender diverse, and Indigenous young people were very overrepresented in this high risk group. And what they kind of concluded was that social media can be seen really as a magnifying glass for what is happening in the lives of young people. It amplifies problems that might already be there. I often think about things like bullying. I've done a lot of work over the last year or so around bullying programs in schools. And what we saw there is, when we were kids and experiencing bullying in schools, we could go home at the end of the school day. But now young people can't escape from it. It's amplified. It's there all the time. They can't get away from their devices, or it's very hard to. So there's a piece in here about how young people use it and the extent to which young people use it. But all of this has kind of led us to sort of say, what we need to do is really find ways to capitalize on the benefits that social media can afford whilst minimizing those harms or those risks. And I suppose it led us to think about what are the levers for change that we've got available to us. So we were thinking, well, there are platform levers. There's, levers with the technology industry themselves, where they could do a better job of regulating themselves and creating safer environments for young people. There are policy levers. So thinking back to the government regulation, what can governments do in a policy capacity? And what can individuals themselves do? How can we educate or better equip users, young people and the families around them to use these environments or engage with these environments safely? So I'm going to talk briefly around 3 new studies that we've done that kind of tackles these or kind of has a closer look at these. And then I'll talk about our Chat Safe program of work, which is an example of one of those educational levers. So we did these 3 relatively new studies. The first one looked at how Australian social media users experience self-harm and suicide-related content. And that was a national survey comparing young people and adults. We then did a second study that looked at the steps that young people and suicide prevention professionals think that the industry and policymakers should take to improve online safety. And the final study was a qualitative study where we did roundtables or focus groups with young people, policymakers, and social media companies. And really the overarching aims of this whole body of work were to really rigorously quantify the problem, the nature and extent of this problem for the first time here in Australia, to provide an empirical basis for the approaches that the industry takes when it comes to safety, and then to be able to provide some evidence-based guidance to policymakers on how to address this policy challenge. So that's what we were setting out to do. And what I've done is combined the findings from all of those 3 studies into what I think is 3 slides, or maybe a few more slides than that. But what we found was there were certainly harms associated with exposure to suicide or self-harm related content on social media. So you can see here around 3/4 of the young people we surveyed had been exposed to self-harm or suicide-related content online. Exposure was higher amongst those with lived experience and often occurred before the age of 16, which makes you think, well, maybe banning social media is a good idea after all, and then young people aren't going to be exposed to this kind of content. As you can see, in most cases, young people hadn't gone looking for it, so they were accidentally, or the content was surfaced for them by the recommender systems or the algorithms on the platforms. And most people reported that it worsened their mood. And for a small but significant portion of young people, it led to increased self-harm. Unsurprisingly, young people were much more likely to be exposed to this kind of content than adults. And as I said, so were people with lived experience. But on the flip side, there were also benefits. So almost 14% of those young people with lived experience of self-harm or suicide had used social media to seek support. They'd most commonly used it to connect with others, receive free and easy access to help, and to seek help without burdening others. So thinking back to what I was saying about those kind of theories of suicide before, these are ways that young people were using social media in a way that potentially might reduce their levels of risk. And again, a finding that I do like to draw people's attention to is a quarter of those young people sought help online because they couldn't get it offline. So they just didn't feel able to, or they couldn't afford to, or there were too long wait lists for them to get this sort of help offline. And young people were significantly more likely to seek support on social media than adults. Yet I would argue that it's adults that are creating these policies and young people don't necessarily have a voice in, even though they're the ones that are most likely impacted by some of these decisions that are being made. So you can see this I often describe this as either a mixed blessing or a double-edged sword, depending on how you think about it. There were some gender differences, so young women and girls were more likely to be exposed to self-harm and suicide-related content, and they were more likely to be experience distress based on what they'd seen, whereas young boys and men were more likely to create content, engage with other people's content, be part of an online group about suicide or self-harm, or seek support on social media, which perhaps surprised us a little bit. Now, the next slide that I'm going to show you, we've done a deep dive into a couple of different populations here and how they've experienced this content online. So the next slide is hot off the press. And in fact, it's still on the press. So I will ask you not to share these data, but we've got, again, a PhD student who's looking very closely at what the experiences are of queer and transgender young people here in Australia. So as I said, this is not yet published, so it's very preliminary. But what you can see here are quite startling findings, actually, where young people, young LGBT people are significantly more likely to be exposed to self-harm or suicide-related content than their non-LGBT peers. And that's even greater amongst trans or gender diverse young people when compared to cisgender young people. Of the vast majority, as with the non-queer peers, the vast majority were exposed to this accidentally and found it distressing, with 30% saying they'd self-harmed as a consequence of that exposure. So again, really high proportions of young people being exposed without looking for it and finding it problematic. But we also found that these young people were much more likely to create content than their non-queer peers, and much more likely to seek help using social media. And again, this was significantly greater in trans young people. So there's all sorts of hypotheses as to why this might be the case. So if people are more likely to create content, they're more likely to be exposed to content because of the way the algorithms and the recommender systems work. But there's also all sorts of reasons why this population might be more likely to reach out and seek help and communicate about this type of thing on social media rather than in the offline world. So it's complex. And I think not all types of social media interactions are necessarily created equally. So moving away from the context for young people, in terms of the industry context, what we certainly heard was that all of our stakeholders agreed that the algorithms and the recommender systems need to be better optimized to not promote harmful content, but to promote educational content, potentially be used to identify risk, and then send helpful content. So, as I was saying before, we think that possibly young people who are using social media to seek help for these problems are more likely to get exposed to harmful content because of the way the recommender systems work. The recommender systems need to be optimized. They need to recognize the nuance that actually there's one thing sending educational or helpful content, but actually very quickly that content can turn quite harmful and quite toxic. And the platforms need to take better responsibility for that. Most of the popular social media platforms have developed all sorts of safety policies and features, including things like blurring certain types of imagery or removing certain types of content from their platforms. How well these are implemented, is up for debate. But young people were much more likely to find those sorts of interventions helpful than adults were. And they found content warnings and the inclusion of helpline information and the promotion of educational content most helpful. All stakeholders agreed that those safety features should be evidence-based. And again, everybody agreed that this is a complex problem. There was real recognition, quite a sophisticated recognition, again, amongst all of our stakeholders, that simply blaming social media alone for the increase in self-harm and mental ill health in young people prevents us from having a robust conversation about all those other drivers that I showed you at the very beginning. So those those decisions that we make about cost of living, about taxation, about employment, about housing, about climate, all of those things are being, the debate about those is being stifled because we're so focused on social media. And then finally, we kind of looked at the policy context. And here we really, our stakeholders and all of our findings identified the need for better regulation of social media platforms. There was a real acknowledgement that this is complex because of that they rapidly change and they're global in nature. So there was a recognition that we need industry, cross-government and multinational collaboration if we're going to do this well. And also there was a real recognition that regulatory reform should be evidence-based and rigorously evaluated. Interestingly, none of our participants recommended blanket age restrictions for young people. And again, I can talk about that a little bit at the end, but there's a real danger here that actually what this is doing is letting kind of platforms off the hook, if you like. Young people will continue to use social media platforms, but they'll be less regulated because there's less onus on the platforms to create safe environments if they think young people aren't going to be there. Everybody, and in particular young people, really identified the need and opportunities for government to support more structured education around online safety and digital literacy, including in school settings. And, we've come a long way in terms of talking about suicide and self-harm in school and educational settings. I don't know how well we really equip young people with digital literacy or competency when it comes to this topic or this subject matter. So there's probably a gap there. And there's also a gap in policy. When we did this work, there were no suicide prevention policies around the world that really included online safety, and nor do they consider the opportunities provided by social media to reach young people for suicide prevention. Similarly, online safety policies or online communications regulation really don't make any mention of mental health, self-harm, or suicide. So there's an opportunity there. And we did generate some recommendations for all of those kinds of stakeholders around that. But there's a real opportunity for some cross-government, proper and meaningful cross-government working when it comes to thinking about suicide prevention in all policies. And you can see there are some recommendations that we took to government in the lead up to legislation being implemented. So I'm going to change tack now and use the next kind of 10 or 15 minutes or so to talk about one educational approach that we've developed at Origin, which is our ChatSafe program of work. And ChatSafe, basically, I'm sure many people will have heard of it. We like talking about it a lot. But it comprises a set of evidence-informed guidelines and a social media campaign that has been co-designed with young people. As I said, ChatSafe is the world's first set of guidelines designed to help young people communicate safely online about self-harm and suicide. It was really born out of that, initial piece of work we did all those years ago, where young people were telling us, as adults, telling us not to use social media to talk about suicide or self-harm isn't really going to work. We're going to do it anyway. So they were really calling on us. They were kind of challenging us for us to help equip them to have those conversations safely. So that's kind of where the first iteration of the ChatSafe work came from. We find ourselves, as I say, at another moment where adults are trying to stop young people having these conversations online, but in a slightly different way. We supplemented the guidelines with a social media campaign that, as I said, was co-designed with lots of young people from across Australia and actually internationally as well. So the guidelines they were developed using expert consensus, a Delphi expert consensus methodology, where we had a panel of young people and a panel of suicide prevention experts. And we trawled the literature to find a series of kind of action items that people thought could go into guidelines about what people should or shouldn't do when it came to communicating safely online about suicide or self-harm. We extracted all of those action items, turned them into a survey, and the survey went out to those two panels who got to rate what they thought should be included in the guidelines. And they're structured in this particular way. So you can see there's some general tips, there's content around how to create self-harm and suicidal content safely, how to engage with content that others might have created. There's some content in there around live streams and self-harm or suicidal acts, around games, suicide games and hoaxes, which unfortunately were a bit of a thing when we were doing this work, self-harm and suicide communities, how to communicate safely when somebody's died by suicide. And we know that, young people do communicate online a lot. Often the first way they hear about somebody taking their own life is on social media. So there was a real need, and I'll talk more about the bereavement work we've done or the postvention work we've done in a sec. But there was a real need for some guidance around how to grieve safely online, how to memorialize your friends safely online. And we've got a tiny amount of guidance in there for influencers. And we have tried working with influencers once or twice with mixed success, perhaps. But there's not a lot of evidence out there around influencers. But I do think probably guidance for content creators would be really useful. And as I said, this was made by and for young people. So we've done co-design workshops all over the country and some overseas, which turned on although we were very proud of our guidelines, young people thought they were somewhat dry or boring. I can't think why. But they really then took them and we gave them chunks of the guidelines, and they worked their magic and turned them into what you can see here on this side of the slide, which is a whole suite of social media campaign content, which is available for people to have a look up, mostly on Instagram. That's probably the best way to find the youth-facing content. And this just gives you a bit of an idea of what that looked like when it came to this bereavement piece. So you can see here, this is what the evidence told us the guidance should include when communicating about somebody who's died. So what to include in the content, how to reduce distress and potential negative effects on your posts. And then that kind of translated into a whole series of words here. And then young people took those words and turned them into campaign content like this that they thought was much more digestible and shareable on social media platforms. So, of course, we wanted to make sure this was safe and potentially effective. So we've done a whole series of studies now around chat safe. So it was developed in that evidence-informed way. But we then pilot tested it in 2 studies to test its acceptability, its safety, and its feasibility. Our ability to safely run suicide prevention campaigns on social media. And we wanted to see whether it could increase young people's willingness to intervene against suicide online, as well as their confidence and safety when communicating about suicide on social media platforms. And so we asked those same questions of 2 populations of young people. One was a general population sample, and then the second study was with young people who had been bereaved by or exposed to suicide. And broadly speaking, our findings were pretty positive. So we had about 200 young people in each of those studies. And you can see here, it did seem to improve young people's willingness to intervene against suicide and their perceived self-efficacy, confidence, and safety. They reported that they were less likely to share suicide-related content online following exposure to the campaign, and they were more likely to monitor their posts for harmful content or to contact somebody if they were worried that they were at risk following our intervention. So presenting a promising picture of acceptability and potential impact. More recently, we've conducted a trial which also had promising findings, and that's kind of out to review at the moment. So watch this space for the trial findings. What that gave us confidence to do, so they were both pre-post studies, but they gave us enough confidence to kind of be thinking that the guidelines at least weren't doing harm, and for many they were beneficial. So we developed a suite of accompanying resources. So we did believe that as much as we wanted to empower and equip and educate young people, we also didn't believe that the onus or responsibility should solely fall on young people to keep themselves safe online. We genuinely believe that the adults around them also had some responsibilities and wanted to feel equipped to help their young people navigate their online world safely. So we developed a whole suite of accompanying resources. So you can see here, there's resources for parents and carers. In doing those, we asked young people what they wanted their parents to know about how to help them. So that was an interesting activity. We've also got a resource here for educators and then a resource for communities that we disseminate, broadly through health services and community organizations and what have you. And they've all got very practical tips in there around how to support the young people in your life around having these conversations safely online. So this is the guide for communities, and this sort of underpins our suicide postvention response. And I kind of wanted to talk about this a little bit because the guidelines and the awareness campaign are really a universal intervention. They're like any form of media guidelines out there that are designed to educate young people to communicate safely. They're designed as a general population intervention, if you like. But we know that young people who have been exposed to or bereaved by suicide are at elevated risk of suicide themselves. And we worry a lot about suicidal self-harm clusters occurring. So we wanted, and we know that a lot of us, certainly the early evidence told us that social media could play a potential role in disseminating information about a suicide death that might contribute to the development or maintenance of a suicide cluster. So again, we started to think, well, how can we use social media to mitigate that risk? Can ChatSafe play a role? And so that's why we did that second study with bereaved or young people who've been exposed to a suicide. And again, we found, as I said, positive findings. So what that's led us to be able to do is deploy ChatSafe campaigns in real time when a youth suicide occurs. So we've now got partnerships with, you can see here, most of the work we actually do here is in Victoria, where I live, where Melbourne's based. We've got an agreement with the Department of Health, but we have agreements with other health authorities around the country. And as you can see, also overseas in New Zealand and the United States, whereby they will contact us when a suicide has occurred. And what we're able to then do is deploy a campaign using sort of geospatial advertising or targeting to the young people and the adults in their lives, in that kind of postcode area. So we might deploy all the youth campaign content, but we will also deploy content targeting parents. So most of the parent content goes out through Facebook. The youth content tends to go out through Snap and Instagram, and also to educators. So if we know a suicide's occurred at a particular school, we will send out campaign content, education content to educators, families, and young people in that community. And we're able to reach large numbers of individuals in a short space of time, quickly, and in an age-appropriate and pretty cost-effective manner. And what you can see here is some of the reach that we've had with this intervention. So the guideline downloads they've been downloaded around 1 million times, just under 1 million times now. Our overarching national campaign, you can see, has reached inboxes or kind of news feeds. That's a big number, that number of times. That's led to this number, a smaller number of click-throughs to our website. And these are our post-vention activations. So actually what you can see here, although we've reached a smaller number, they've been obviously much more targeted. They've actually generated a higher click-through kind of transition rate. So what you can see is actually if you start targeting these interventions to people that might need them in that moment, we'll actually get greater cut-through. And we're starting to really challenge ourselves here, thinking about what we now know about the algorithms and recommender systems. Do we really want to be pushing out this kind of helpful and educational evidence-based content to young people, even though we think it's good and beneficial, if the recommender systems will then start surfacing potentially harmful content to the young people? Are we better off starting to think about deploying this in a much more targeted way to people who need it in the moment? And that's one of the challenges that we're debating as a team at the moment. We have, however, translated the guidelines. We've partnered with organizations in 22 different countries, and they've been translated into 29 different languages now, which is amazing. So to wrap all of that up, youth suicide rates are high, they're unacceptably high. And in some countries, including where I am in Australia, rates are increasing and appear to be this intractable problem. So we do need to be thinking differently about how we tackle that. And we certainly need to be involving young people on that journey with us. We need to be asking them what they think is going to work, what they think is worrying them, what they think is contributing to suicide risk for their cohort or their generation. And we need to be listening to that. And that needs to be informing our interventions and our research, but also our policy decisions. We know that those factors are complex and they are multiple, but probably legitimate, genuine concerns exist about the role social media could be playing, certainly for some young people, even though we know there are also some benefits when it comes to using social media for the purpose of suicide prevention. We do know that ChatSafe seems to increase young people's willingness and capacity to communicate safely online about suicide, including those people who've been bereaved by suicide. But I do think more work is needed to ensure that we are continuing to kind of reduce the potential for harm, given the ever-evolving online landscape. and more work is needed so that we can fully capitalize on those unique benefits that social media does provide. And we need, again, to challenge ourselves. If young people are there anyway, what are our responsibilities about helping keep them safe in those environments, whatever we might think of the platforms or the companies? And we do need to partner along the way. So we need to be partnering, like I said, with young people, with the industry to the extent that we can, and with policymakers. And I strongly believe that online safety does need to be part of the future of suicide prevention policies and activities, whether we might like it or not. Thank you very much.
Wonderful. Jo, thank you so much for this exceptional presentation. And it's remarkable to see the amount of work that has gone into this topic, spanning a couple of decades now. I'm always in awe when I hear you present this extensive research program. So thank you so much.
My pleasure.
So now we've got time for discussion and questions, and I'd like to invite our delegates to use the Q&A function to post their questions or comments to Jo. But just to kick us off, Jo, I was really interested in, I think it was one of your studies of where you said that 25% of young people sought support online. They used, so can you expand a little bit on what sort of support they were reaching out for? Was it peer support? Was it, I don't know, online helplines, for example, online counseling? Did you have an idea?
So it was 25% of those that had lived experience of suicide or self-harm had used social media to seek support for those problems. Yeah. And it was either looking for peer support or looking for kind of advice. It was not professional help. They weren't going on there, and it was because they couldn't get professional help. So it wasn't like they were going on and using chat functions for Lifeline or crisis text line or something like that. Yeah, they were going on there and reaching out to their peers for help and support. And, you know, one of the focus groups that we did with young people, I'll never forget, one of the young people said, it feels easier to go online and put a post out online and see who responds rather than burdening your parents or professionals around this, because people then have the choice to ignore it. And it kind of, you know, as a parent, it kind of breaks my heart, because you think the last thing, you know, you want your kids to come to you if they're having problems like this. But young people really felt they didn't want to burden their parents. And it was less of a burden to just put something out there online. And that way people could choose to ignore it if they wanted to. What was also interesting is that young people who saw those posts also did feel like a bit burdened by them. They did feel the weight of that responsibility. So it was almost like the burden felt invisible to the person posting it, but actually the person on the receiving end, it had a different impact for the person on the receiving end, because then they didn't know what to do. And again, young people didn't feel equipped. They wanted to help their friends, so they wanted to jump in. They didn't feel they could ignore those posts, but they also then didn't know how to get out of those conversations. So then they found themselves, you know, stuck in them. So one of the things we did in addition to of the chat safe guidelines actually had some specific guidance in there around how to end those conversations and when it's okay, and how to kind of pass them on for other help rather than for other young people to feel that burden.
Yeah, wonderful. Thank you. Thank you, Jo. We've got a question. I'm just going to read it out. You talked a bit about work with influencers and content creators. Did you find you had good engagement from them, or what were the barriers, if there were any?
Yeah, well, the kind of were, you know, and I'm probably not I'm a little bit more removed from all of this work now, so I'm probably not the best person to answer this question. But we have worked with content creators a little bit, and, you know, they have got excellent reach, which is fantastic. So they really are able to reach lots of young people. They also find themselves in conversations, again, because, you know, if you've got an influencer or a content creator that is talking about mental health, again, they can sort of find themselves in conversations they're not necessarily equipped to manage or deal with. So again, we had to kind of provide some guidance for them around how to kind of, you know, look after themselves in those conversations, about where to draw their boundaries and those sorts of things. We've had mixed results working with content creators or influencers, to be perfectly honest. And as I said, they do have good reach, but you do lose some of or there's the potential to lose some of the integrity of the content because you can't necessarily always control what people share or how people share it. So we did do, or a couple of the team members did do some workshops or some educational workshops for content creators, which have been quite well received. But there's probably more we could be doing on that, I think.
Thank you, Jo. And one of the things that I know, very well, and it's always, really important in your research program is that all your work is co-produced. So I was wondering, for this research program, what are some of the safeguards that you and your team put in place to ensure the safe and meaningful involvement of young people in this program of work?
Yeah, that's a really important question, actually, Maria. Thank you. So we didn't go into this. First of all, we didn't go into this program of work lightly. So we'd done some work beforehand, so some pre-calls, if you like, where we had gone in and started working with a small group of young people around this topic and working with them to create some very small scale social media content around suicide prevention. And I remember doing it. So I remember going into a classroom full of school students. And, we had a team with us. We had clinical psychs with us on site. So we had quite a well-equipped team with us. And I thought, really, and back in the day, even, talking about suicide in a classroom full of students, let alone saying, please get out your mobile phone and search for suicide, was a bit controversial. I was like, really, am I going to be the person that's doing this? But, we didn't feel we could ignore it. And young people had said, we need to do this. We want you to do this. So, we kind of went into it quite gently and quite carefully, and we started very slowly. But we also evaluated what we were doing. So we measured everything. So we had many staff on site whenever we did a workshop. It was very well resourced. As I say, we evaluated it. So we were looking mostly to see whether there were any negative effects of young people taking part in the co-design workshops. And this is right back in the early days when we started this work. But what we also found was that young people learned a lot from being part of the workshops. Like, we were really doing it. We wanted to make sure we were keeping them safe, but we also wanted to co-produce a suite of campaign content. A byproduct of that turned out that actually young people felt better equipped to talk about suicide on and offline, better equipped to help their friends. They enjoyed the workshops. They felt they were contributing to something useful. So, we kind of gained confidence along the way by the evaluation and by what young people were telling us. But we also did a lot of other things. So we had wellness plans, what we call wellness plans, where we got young people to fill in a wellness plan before they came along. They had to nominate support people. They had to also kind of identify a few things that help them, if they're feeling stressed or distressed. What can we do to help them? So we'd identified all of those things. We had people give them a call before they came along to the workshop to make sure. So we did all the consenting kind of on the phone. So we chatted to them before. They knew what they were coming to. And we were very thoughtful about the space we used. There was breakout space. There was enough of us on site in a workshop that if somebody became distressed, we could take them to one side. We had sensory toys and all of those sorts of things there, warm up, cool down activities, all of those sorts of things. We had very few adverse events in those workshops, but I will say the ones where things did go wrong were the workshops where we'd rushed, where we didn't have enough staff on site, and we hadn't gone into it thoughtfully enough. So we put a whole load of work into keeping young people safe in those sorts of workshops.
Absolutely, absolutely. And that also, highlights the importance of resources and how important it is. If we want to co-produce research with young people, for young people, we need to do it properly, and it needs to be properly resourced as well. And I know Origin is an international leader in youth involvement and patient and public involvement.
Yeah, that's right. And, we are very passionate about youth participation and youth-led work. You also need to give up a bit of control, and be willing to give up some of that power.
It's hard sometimes.
Which is hard for researchers who bring a lot of ego to their work sometimes. So what I will say was also doing the Chat Safe work has probably been one of the most fun projects I've ever had the privilege of working on throughout my career. And, it sounds a little bit odd to say that doing a suicide prevention program of work can be fun, but ChatSafe has been lots of fun. And I think that has been testament to the young people we've worked with, because, seeing them turn those dry old words, those evidence-based words of guidelines into kind of, social media content, and really bringing it to life has been, it really has been amazing to see them do it. So you couldn't do it. You couldn't do a project like this any other way, I don't think.
Absolutely. Absolutely. Can I just appease me, Joe, and just join me in the frustration of connecting research to policy? Producing evidence and presenting evidence to different stakeholders, policymakers, different representatives from governmental bodies, and feeling that you are heard but not necessarily listened to.
Yes. Well, I think I
the most
share all of these.
Put in.
Yes. Well, and I'm mindful we're being recorded. But we, it can be really frustrating. I've spent a lot of time on advisory groups for the social media industry, providing advice to them about ways of, creating safe online environments when it comes to suicide and self-harm and mental health, and providing a lot of advice that perhaps hasn't been necessarily embedded into those platforms. And it is frustrating. But I also have kind of, I suppose, been motivated by the fact that if we're not there giving them that advice, then who is?
Yeah.
So, we do need to be telling them what is safe practice and what is unsafe for young people on those platforms or those environments. We did a lot of advocacy in the lead up to the introduction of the minimum age legislation here in Australia. And our advocacy really wasn't suggesting a ban. We really weren't saying, we were, for all of the reasons that IEPA members will be aware, we were very much thinking, this isn't the best policy approach that we could take. It's not evidence-based, but also there will be unintended harmful consequences. And it probably isn't really putting the responsibility where it should lie, which was on the platforms. And, the government went ahead and introduced the legislation anyway, which might look like nobody listened to us. But two other things did happen off the back of, and it wasn't just us that was doing this advocacy. For once, the youth mental health sector was very united. Two important things probably happened off the back of that advocacy. One was that it's being evaluated, because we were saying this isn't evidence-based policy, and it is now. They've invested money in evaluating it properly. And we also said there will be unintended harmful consequences for young people who are using social media platforms to seek help, including for suicide risk. And they did then provide a whole investment of money into youth mental health services that will start to flow from this current budget that's just happened. So I think we were heard to a certain extent. We didn't necessarily get the policy response that we wanted, but there were some other policy initiatives, I suppose, that happened in tandem that I think is probably testament to the advocacy that many were doing at that time.
Yeah, thank you, Joe. It's very tricky, isn't it? It's very complex, and it's certainly in the UK. I think we're moving probably towards that direction, despite the fact that we very regularly advise the government about research that we have produced from the Smart School study, and we had Professor Victoria Goodyear here, the first webinar, the inaugural webinar, presenting a program of work on the Smart School study. And then despite that, I think we can see that sort of it's really difficult. It's not policy palatable, isn't it? And it's highly political, as you said before.
It is. It's highly political. And I think that's certainly what supercharged it here. It was a political decision, and it was driven, in some ways by families with lived experience of losing children to suicide, which they attributed to online bullying. And it becomes very hard to be pitted against that level of that type of lived experience. So it's really difficult. So it did become a very heated environment here, I think. But what we've done is maintained a really open dialogue with the policymakers, actually, and their advisors. And we've sort of said, well, this is where we are. It's probably not the policy response we advocated for. We can see why you've gone in this direction. I do think there will be benefits for some young people to not have access to social media. And maybe the benefits won't be seen now in this cohort of young people who have had something taken away from them.
Yeah.
But if we can shift societal norms, and in a few years' time, there's young people who just grow up not expecting to have social media until they're 16, the outcomes might be different for those young people. And, the other thing is that the outcomes might be different if everybody around the world, if all countries start legislating in this way. Actually, the platforms might, I don't know how much those companies really worry too much about Australia. We're a fairly small market. But if the rest of the world, particularly a European bloc, moves in this direction, I think maybe they will take a bit of notice, and maybe they will say, oh, actually, maybe we do need to. Maybe they'll have the impetus to, regulate themselves a little bit better. And that would be a good thing. So, I'm trying not to see it in too much of a dichotomized way, I suppose.
Wonderful. I'm just mindful of the time. So I think we're going to bring this webinar to a close here. But before I do that, I would like, first of all, to thank you, Jo, for the expertise and the passion that you brought to this global conversation on behalf of the IEPA. Thank you so much.
Thank you for having me.
Very big thank you to all our delegates from joining us from across the world. The recording of the webinar will be available if you are an IEPA member. If you are not, please do join our membership. It is free. And then you'll get the pleasure of having Jo's recording webinar, but also many, many other benefits that our membership has. So once again, thank you very much and have a good day or a good evening, everyone.
Thank you.